8:18. Welcome back to 2 News Today on Dayton CW. I'm Dan Edwards. Jamie's forecast and Carrie's traffic update is just ahead. And now we want to talk about a concern for parents as children's concussions are on the rise. And to talk about this growing trend, Dr. Laurence Kleiner, who is the pediatric neurosurgeon at Dayton Children's, joins us to talk more about this. Obviously, Doctor, first off, thank you for bringing this topic to our attention. We look at the kids playing football. How big is a problem is it for these young guys and girls too that are playing?
It's true. Concussions is a major concern now, and we've found that the rate of concussions in high school play is almost 62,000 a year.
Wow. So that is obviously those numbers growing and a growing concern for you.
Yes, there are. There's over 150 million participants in high school and college sports each year, so it's a very big problem, and we've learned more and more about it as time has gone on.
Now, what are you, I guess concussions from football, but that's not the only sport that sees its share of concussions. What are some of the big sports that we have to be aware of?
Well, overall in all head injuries, the sports account for about 10% of all the bad head injuries that we have. Football is a major one, but also lacrosse, soccer in young women are all other major contributors to concussion these days.
So what are the signs that we should be looking for if we think maybe our child has a concussion or has symptoms of?
I think a major important factor is that loss of consciousness is not necessarily the definition of concussion, but rather if someone is even stunned, where they said they got their bell rang.
Bell rang. You see stars. I mean, when I played football, you'd see the proverbial stars floating around.
Right. And what we've learned is that is concussion. You don't need a loss of consciousness. In fact, loss of consciousness is only in about 10% of concussions. So it's getting your bell rang, then having afterwards headache, nausea, vomiting, photosensitivity, light sensitivity, hearing problems, concentration problems, even getting irritable, having sleep disturbances. All those are post-concussive syndrome.
Can you still function even when you have a concussion that virtually knocks you out?
Well, yes, you can, and that's the problem, is not recognizing that there's been a significant injury in the first place. Frequently people in sports want to get back to the sports, and they want to get back in immediately. We've realized that that's a mistake. And over half of the states now have specific laws, Ohio included, with our specific Ohio return to law that's been passed and is inactive as of April of this year.
April of this year.
April of this year.
What does this law apply to?
Well, it mandates that you cannot return the same day when you're deemed to have a concussion. That's a major factor. Two, the important thing also is that coaches are mandated to have now special education in terms of recognizing concussion, a major, major step forward.
Are we overstimulating our children, keeping them too active and starting them out too young, in your opinion?
No, I don't think so. I think there are certain limits of very aggressive sports. If we go too far down, the body hasn't matured enough to accept the type of injuries that can occur. But I think another thing, we want to encourage our youth to be active at all times. As you know, weight is a major problem in our country right now. And so we want people to be active, but we want them to be active safely.
All right. Doctor, thank you for sharing information with us this morning. We appreciate it.
Thank you, Dan. Thanks for having me.